In January 2020, a coronavirus outbreak happened in Wuhan, China, with over 90,000 people infected. After 2 months of effort, China has contained the virus perfectly. As of contrast, the spread of the coronavirus in the US has never stopped.
We have it very much under control in this country. We had 12 at one point, and now they've gotten very much better. It's going to disappear. One day, it's like a miracle. It will disappear. Looks like by April, in theory, when it gets a little warmer, it miraculously goes away. I hope that's true.
Stop. The Trump administration never intended to contain the virus. Trump even encouraged people to go out and social interact instead of social distance. The curve kept going higher and higher. A big hatred started in the US society toward Asian Americans. One of the data we collected about the infection of coronavirus in different races shows a tremendous difference between different races. Asians are obviously the best in fighting against the coronavirus. Lowest case rate compared to white people. Unfortunately, all of those races have a higher hospitalization rate and also death rate compared to white people. This means that white people have a tremendous advantage in receiving medicines and treatments. Coronavirus reflects the gap between the rich and the poor. A big percentage of minorities don't have much savings. If the government can't contribute them or reduce the cost of medicines, most of minorities can't afford health insurance, so they pay a huge amount of money for their bill. To protect the rights and welfare of minorities, in the US, the government should provide cheaper medical insurance and basic living materials for minorities. Here is the data we collected about the vaccine distribution. We can see that there are over 80 million vaccines have been produced, but only about 60 million vaccines are distributed to people. This means that the government isn't doing the job correctly in vaccine distribution. They could have done it sooner. Now, let's watch a short interview about how Dr. Fauci says about the vaccine.
About the pandemic is that serious, well-meaning people get stuff wrong sometimes. In the initial months, you made some statements about masks, for example, or asymptomatic spread that you later revised as you learned more. I'm just wondering, does that humble you?
It's sometimes humbling because you have to make a decision based on incomplete data. If you had all the correct data at any given time, it would be very difficult to make a wrong or stupid decision when you have all the information in front of you.
You look like you're 60, but you turned 80 in December. And I'm wondering, did you worry at any point that this virus might get you?
Yeah, I think you'd have to be oblivious not to consider the fact that if you get infected, that you are already in a category of someone who has a high risk of having a serious outcome. I didn't fixate on that, but it was in the back of my mind because I had to be out there. Particularly when I was going to the White House every day, when the White House was sort of a super spreader location. That made me a little bit nervous.
Hi, Peng.
Hello.
What do you think about the coronavirus? It has been a very serious disease around the world now.
Yeah.
What do you think about it?
Yeah, as you said, it's been a worldwide pandemic, so we need to be very careful about this coronavirus. Be careful of yourself. But if we take a look of the list of the world who are getting the coronavirus the most, it's the America. So yeah, and I do believe
So
that.
talking about the United States, they have the most cases in the world.
Yeah.
And also, not only the coronavirus is a problem, the minorities they're having difficult time fighting this pandemic. What do you think about minorities during this pandemic in the U.S.?
Well, personally, I do believe that the minorities are a special group in U.S. because they are getting lower wages than other normal Americans, so they are having a very difficult time through last year because they are getting they do not have enough money to buy treatment insurance and also some food, even some basic living materials. Yeah, and what do you think the other countries that are treat the minorities differently than the U.S.?
That is a very good question, Peng. So from data I found, the U.S. has over 30 million cases and 500,000 deaths, but compared to another Western country like UK, they have only 4 million cases and only I believe is 130,000 deaths. So they're all Western countries, and they have that kind of different policy to fight the coronavirus. US might be more liberated and free. People don't apply the rule, so that it's kind of hard to fight the virus. But UK it's also a Western country, but they're doing much better on fighting the virus and treating minorities there.
What do you think about the solution that?
So I think so it contains two parts. First is the coronavirus. Second is the life of minorities. So if we combine them together, what I would say would be, having the government giving the minorities a fair amount of money, like supply them with economic help, pay their medical bill, whatever that is, so that they can get over this pandemic. And also, not only money, the true weapon to fight the virus is the vaccine. So what do you think, who should get the vaccine first, and then, how do we distribute vaccines?
Well, I do believe that the first group of people who should get the vaccine are the doctors who are fighting the first line to the coronavirus, and the second part of people I do believe is the children, because they are our future. Like, if we can protect them better, then our future gonna be bright. And the third group of people are the older people. They're getting coronavirus easily than us, and then I do believe the group of people should take the vaccine are people like me and you. And the last group I think is like older than us, but not that much, but also younger than the older people. People in age between 30 to 15. That's the best idea I can give.
Yes, I think that's a very good plan to distribute the vaccines. Above all that, what we can do as individual, we can wash our hands, social distance, and wear a mask, to fight the virus. And that was a really good conversation. Thank you for your time, and goodbye. Bye-bye.